Welcome to the CPS Energy Health Plan presentation. My name is Lisa Quevedo from the CPS Energy Health Team. This presentation will cover plan eligibility, Medicare discounts and coordination, CPS Health monthly premiums and cost-saving tips. Under the current plan design, active employees can continue coverage in retirement for themselves and any dependents enrolled in one of the three CPS Energy health plans on the last day of employment. Children are eligible to continue coverage through the age of 26. In the event of a retiree death, a surviving spouse may continue coverage at 100% of the total premium, which is the employee cost plus the full employer cost. At the age of 65, you meet Medicare eligibility. Medicare will become your primary coverage, and the CPS Energy Group Health Plan will become your secondary coverage. Medicare Part A covers hospitalizations, and there is no monthly premium. Medicare Part B covers services other than hospitalization and requires enrollment with a monthly premium cost. Upon reaching Medicare eligibility, the CPS Energy Health Plan will process any claims as a secondary coverage, assuming you enrolled in both Parts A and B of Medicare. If you do not elect Part B of Medicare, you will be responsible for the 80% Medicare would have paid if applicable. If Medicare pays less than 80% what your plan pays, CPS Energy will pay the difference up to the 80% if applicable. When you become eligible for Medicare and it becomes your primary coverage, CPS Energy will apply a monthly discount on your premiums. The discount would apply to both retirees and their spouses upon reaching Medicare eligibility. CPS Energy will mail information regarding the premium discount approximately 30 days prior to your 65th birthday. If you become Medicare eligible prior to your 65th birthday, please notify Employee Benefits. Medicare coordination only applies to medical services. The retiree dental and vision coverage remains the same without any coordination from Medicare. If you retire prior to completing 35 years of employment or younger than 55 years of age, you will pay a portion of the employer cost based on equity plus the employee cost. Surviving spouses pay 100% of the total cost. This means 100% of the employer cost plus the employee cost. If you have been participating or completed wellness activities, the wellness incentive does not carry into retirement. For information on discounted gym memberships, visit bcbstx.com. This is an example of how the employee's credit is calculated to determine the employee's equity. The equity is the percentage of the employer's costs the retiree will pay in addition to the employee cost. The retiree in our previous slide with 35 years of service and at least age 55 in a plan with a spouse will pay the active employee cost of $293.09 plus $17.27 for dental coverage and $3.68 for vision coverage. This means the total cost for the health premium is $314.04 per month because the retirement equity is zero based on age and years of service. The retiree is not paying any portion of the employer cost of $1,063.20. In this example, the retiree has 25 years of service. Years worked between 0 and 5 do not receive a credit contribution. 2 credits are given for each year worked between 6 and 25 years, and 6 credits are given for each year worked between 26 and 35 years. Because this retiree in this example worked 25 years, they will receive 2 credits multiplied by 20 years, which equals 40 credits. The total of 40 credits is then subtracted from the 100 possible credits to determine the retiree's equity percentage. The equity percentage is a percentage of the employer's premium the retiree will pay to determine the total cost of health insurance. The higher the credit, the lower the equity will be. Based on the previous scenario, a retiree with 25 years of service and age 55, covering a spouse on Plan A, will have a total monthly health premium of $951.96. The retiree will pay 60% of the employer cost, which was the equity calculated on the previous slide, 60% of $1,063.20 of the employer cost, the active employee cost of $293.09, plus the $637.92 of the employer cost. Additionally, the dental and vision cost for a total monthly premium of $951.96 per month. If you retire prior to age 55, there is an age reduction factor. A 6% reduction is calculated for each year under age 55. In this example, the person is 53 and a half years old with 25 years of service. Based on the years of service, they are given 40 credits. The age reduction factor is also taken into consideration using the 6% reduction formula for a total reduction from 40 to 36.4 credits. As a result, the employee equity is 63.6%. This is the premium portion of the employer premium you are responsible for. Using the same scenario for a retiree and spouse under Plan A, the difference in calculation is the equity percentage. The equity percentage changed from 60 to 63.6 due to the age reduction factor. The resulting cost to continue health coverage would be the active employee cost of $293.09 plus the equity percentage of the employer portion of $676.19, plus the cost of dental and vision, for a total initial cost at retirement of $990.23 per month. This scenario displays the credit calculation of a retiree with 30 years of service and age 55. Because this employee worked 30 years, they are given 2 credits for each year worked between years 6 and 25, which equals to 20, and 6 credits for each year worked between years 26 and 35, a total of 5. 5 years times 6 credits equals to 30 credits for a total of 70 credits. By subtracting the 70 credits from 100% of total cost, this leaves a retiree equity percentage of 30. In turn, a retiree with 30 years of service and age 55 with retiree-only coverage will pay a total of $263.78 per month. 30% of the employer cost is $166.47. The active employee rate for single coverage is $90.96, plus the $166.47 of the employer cost. And with the cost for dental and vision, the total is $263.78 per month. All of our plans are bundled, which means when you choose to continue health coverage, your benefits include medical, dental, and vision. You cannot separate the plans. Lastly, here are some cost-saving tips to consider. Make healthy lifestyle choices to reduce medical expenses. You can also visit bcbstx.com for additional resources and program discounts. When obtaining prescriptions from your provider, ask for generics when possible and use the mail-order pharmacy for prescription drugs, or 90-day supply for maintenance prescriptions. Visit CVS Caremark at caremark.com for additional resources and discounts. Thank you for your time. If you have any questions or need additional information, please contact Employee Benefits at 210-353-2900 or email your questions at empben@cpsenergy.com. Thank you.